So, this is Dr. Scott Yeller, laser floater specialist, I could say, or extremely experienced ophthalmologist in Fort Myers, Florida, April Fool's Day 2019. We have a great patient from Lancaster, PA, living in Naples during the winter, Naples, Florida. And last August, you had what's called a posterior vitreous detachment. I don't like that word. I'd rather say posterior vitreous separation, but detachment has too many other negative connotations. But in any case, associated with it, you had a very simple, not exactly Weiss ring, which is a classic structure, but a hyaline opacity. And what was your impression when you had that? I mean, it was disturbing you or
It was
blurring?
very disturbing. It was very annoying and really was getting me like just bothered all the time because I had a big blob and then I had like a black conglomeration that looked like an insect in there. And when I would move, it would move.
Right.
So I could never catch it. It was very disruptive to my vision.
Yeah, yeah, and people have different levels of sensitivity. Some people have eye floaters, and it doesn't seem to disturb them. Other people have floaters that actually blur the object they're looking at. One-eyed patients are especially susceptible to problems. But we performed 2 laser sessions. After the first laser session, did I not get it?
Can I be honest?
Yeah, of course.
I got in my car and I started to cry because that big conglomeration of black stuff, protein, I guess, was gone. And I could actually see clearly, more clearly, for the first time in months. And that was just heartbreakingly wonderful to me.
That's great. And you had some very prominent retina specialists up there in Lancaster. I don't know, they didn't poo-poo laser. They just said they don't do
They
it.
don't have it. They don't have any
They
in
don't
the
do
area.
it. Didn't have any experience. Wills Eye Hospital, great place, famous institution from the 1800s, but no experience in this area
Right.
for whatever reason. And they reluctantly said you might consider a vitrectomy, but they really didn't want to get into that.
That's
Vitrectomy, when we get over 40, is like guaranteed cataract, almost
And
100%.
they were clear about that.
Yeah,
They
yeah.
reiterated
And
the
not every
danger.
surgery goes perfectly. I have never seen a retinal detachment associated with laser. That is a complication of vitrectomy, so it's not an easy thing for a patient to undergo. But we did a second session. I cleaned up a few little escapees, correct? And now you're a happy patient, right?
I'm a happy patient.
If you're a happy patient, I'm a happy doctor. I'll send a note up to your prominent retina specialists, and maybe they'll actually come and see firsthand what can be done. If I were at Wills Eye Hospital, I'd have a dozen residents. They could write papers and all that, but I enjoy doing this.
People come here
Yeah,
from
yeah,
far
yeah,
away because
yeah.
that's what I did.
Yeah,
I
this
waited
morning
till I
we
got
had a
here.
doctor from Brazil. I told you that. And you're a great patient. I can't wait to send a letter to your doctor up there, and maybe they'll actually take the time to learn a little more about this.
Great.
You're a great patient. Have a great summer.
Thank you.